Hello everyone, myself Dr. M. Parveen. So today we'll discuss about antihypertensive drugs. Before discussing it, we must know what is hypertension. So as you all know, hypertension means increase in the BP. And how much? Now we'll discuss it. So basically antihypertensive drugs are the drugs which are used to reduce BP in hypertension. That means it helps to decrease in the blood pressure when the patient is having hypertension. Now why it needs to reduce the blood pressure? Why the blood pressure needs to reduce? Because when the patient is having higher systolic or diastolic blood pressure, it may lead to various cardiovascular diseases. So to prevent that, we need to maintain or reduce our blood pressure. Okay, coming to hypertension, it's a very common disorder. Now it's seen in everybody, especially the patients who are of middle age. So it is not a disorder. Basically it is not a disease, but it is important risk factors for cardiovascular mortality and morbidity. That means it may lead to, it is not a disease, but when it is increased in our body, the blood pressure, it may lead to various cardiovascular diseases. Definition. Now coming to the definition, according to the GNC 7 and WHO ISH guidelines, hypertension is defined as increase in blood pressure, which I told you, more than 140 mm Hg, systolic and diastolic is 90, that will be 90 mm Hg. Though risk factors like this appears to increase even above 120 to 80 mm Hg. So as you might have seen in the hospitals and in the clinics, that ideal blood pressure is considered as 120 by 80 mm Hg. So according to GNC 7, when it increases more than 140 by 90, it is considered as hypertension. But in normal condition or in ideal situation, 120 by 80 mm Hg, when it passes or increases than 120 by 80 mm Hg, it is also considered as hypertension. So as you can see, I have written higher the blood pressure, greater the risk of cardiovascular diseases. Now coming to the classification. According to GNC 7 classification, the patients who are considered as normal, having a systolic blood pressure of less than 120 mm Hg and diastolic blood pressure of less than 80 mm Hg. So what we can do is, we can suggest them any antihypertensive drugs and also tell them to change their lifestyle. So lifestyle modification is necessary. Pre-hypertension, the patient having systolic blood pressure of 120 to 139 mm Hg and diastolic blood pressure of 80 to 89 mm Hg are considered as pre-hypertensive patients or pre-hypertension. Stage 1 hypertension, patients having systolic blood pressure of 140 to 159 mm Hg and diastolic blood pressure of 90 to 99 mm Hg are considered as stage 1 hypertension. Stage 2 hypertension is when the patient's systolic blood pressure is more than or equal to 160 mm Hg and diastolic blood pressure is more than or equal to 100 mm Hg is considered as stage 2 hypertension. I hope this much is clear for you all. If not, then please comment down so that I can explain you in the next video. And now we'll discuss about the drugs, classification of drugs. Coming to the classification of drugs, so the drugs which are mainly used for antihypertension are diuretics, renin-angiotensin system inhibitors, calcium channel blockers, sympathetic inhibitors and vasodilators. The drugs which comes under diuretics are thiazides, high-ceiling and potassium sparing. So thiazides, in thiazides there are hydrochlorothiazides, chlorothiazides, chlorthalidone, indapamide, high-ceiling furosemide, potassium sparing is spironolactone, amiloride and eplerenone. All the doses and mechanism of action I will discuss it later in the next video. So till then, like in this video I have only discussed about hypertension and classification of drugs. So I hope you can manage it. So coming to next, that is renin-angiotensin system inhibitor. AC inhibitors are captopril, enalapril, lisinopril, ramipril and there are so many. Then AT receptor blocker, that is angiotensin receptor blocker, losartan, valsartan, telmisartan, etc. Direct renin inhibitor, aliskiren. Calcium channel blocker, there are phenylalkylamine, benzothiazepine, dihydropyridines. Phenylalkylamine, verapamine, benzothiazepine, diltiazem, dihydropyridines, nifedipine, amlodipine, and felodipine. Coming to sympathetic inhibitors, the categories which comes under sympathetic inhibitors are beta adrenergic blockers, alpha adrenergic blockers, alpha plus beta adrenergic blockers, and central sympatholytics. So beta adrenergic blockers, the drugs are propranolol, metoprolol, atenolol. Alpha adrenergic blockers, prazosin, trazodone, doxazosin, and phentolamine. Alpha plus beta adrenergic blockers are carvedilol, labetalol. Central sympatholytics are clonidine, methyl-dopa. Vasodilators. Now let's talk about vasodilators. So the two categories which comes under vasodilators are arteriolar dilator, arteriolar plus venodilator. Arteriolar dilators are hydralazine and minoxidil. Arteriolar plus venodilators are sodium nitroprusside. So in the next video, I will be discussing about the mechanism of action of each and every drug with the dosage forms and drugs available. The dosage form and the doses. So I hope this much you have understood, and I hope this will be helping you in your exam or in your seminar. So please comment down if you have understood already this much, and if you want me to make videos on another topic also. I hope you like this video. Thank you.